Hi, I'm Steve with Fitness for Five, here with Dr. Nario, Biointegrative Health Center in Reno, Nevada. You can look them up online. They're integrative health. Very interesting and worth looking into if you have any type of an ailment. So, hello, doctor. Welcome.
Hi, Steve. Thanks for the invite again.
Okay, so let's talk about the flu today. You know, we're in interesting times, so flu is not anything that we don't really hear about it anymore, but I mean, the flu can be dangerous, right?
Yes, Steve, and you're right. The flu is still here. Winter, as we all know, is one of the bigger threats, what we call the flu or the influenza infection. As we all know, the spotlight has been stolen by COVID. Talk about stealing someone's thunder. But the thing
Yeah,
here is,
that's
yeah,
really not fair to the flu. So,
I know,
what
but
is the
it's still
flu?
here.
What's the
Yeah.
flu?
Well, it's still lurking, and even it hides behind COVID. That's what it seems like it now. It's still a one-two punch attack to our immune systems. Everybody has to understand that. But the influenza virus is a contagious viral infection. It sets up camp in our nose, throat, and lungs, and it spreads through respiratory secretions. And it can also cause what we call flu-like symptoms, which are mild to moderate. And with a low immune system, it can be very serious and can even lead to death.
Okay, so what are some of the symptoms? I know, I mean, maybe you can have an upset stomach or whatever. You're not really talking about that, but what are some of the just specific signs or symptoms of the common flu?
Yes, so Steve, the common flu presents in a very non-specific way. But just to run through the common signs and symptoms that you would see would be fever, or even feeling feverish or chills, cough, sore throat, runny nose, stuffy nose, muscle or body aches, headaches, fatigue, vomiting, and even diarrhea, as you mentioned. But these symptoms of gastrointestinal problems will be more evident in children rather than adults. Though not everyone will be having a fever when you have a flu. So you always have to remember that. And symptoms of the flu and COVID-19 are almost similar. So it's hard to tell the difference between which is which just by using symptoms alone. Only way you can put a line through that is through diagnostic testing. And we can understand as we see that we do the nasal swabs for both. And once we isolate it through these tests, then we would know which one is the culprit.
Okay, so do you have any flu statistics? You know, how many people, maybe how many people get the flu? Do you know off the top of your head any statistics that have to do with the flu? I know they're probably distorted the last couple years, but you know, recent flu statistics. What
Right.
can you
Well, you
tell
are
us?
correct. You are very correct about that, Steve. The thing here is the entire 2019-2020 season, at least 400,000 people were hospitalized for the flu, and 22,000 died, including 434 children to be exact. CDC had described as it's a severe manifestation for kids 4 year old younger, and for adults 18 to 49 years and even older. It's usually appearing in the months of October to May, again, winter as we generalize it. And the problem here is the numbers that I just mentioned, and you also mentioned that it's kind of skewed in a way for the reason that surveillance had been impacted by COVID-19 pandemic and should be interpreted with caution. That's why now, as you can see, the overlap and the mixing, and we were talking about this a few months ago that, hey, this is something that we have to face and we're going to have a problem with.
Did you say 400,000 people hospitalized?
Hmm.
Wow.
That's
I mean,
2019, 2020.
400,000 people coming down with, but you said hospitalized. That's
Mhm.
crazy.
It is. It
Wow.
is. Yeah, just shows the immune system of everybody not being the best shape And again, why? You have to remember everything that happened. Social distancing, quarantining, I guess not having the best resources for food, the stress. There's so many things that can contribute to this.
Is that number up? Is that higher than it was in 2017?
To be honest with you, it's not. The thing here is, again, these numbers are almost lower than what it was from previous years. But as cautioned by the CDC, these numbers can be skewed or altered because of the ongoing COVID-19 pandemic.
Gotcha. Okay, so what do you do? Somebody has the flu, um, conventional treatments. What do they usually do if they want to treat someone conventionally who has the flu?
Well, your doctor most of the time will tell you it's symptomatic treatment. Symptomatic treatment meaning hydration, anti-inflammatories, Tylenol. This is to address the fever, the body aches, and even grandma's homemade chicken soup can help with this. The thing here is the usual recommendation of CDC though is the vaccine. When you talk about the vaccine, there's a problem. Problems such as it does not assure complete protection. The contents only covers the most common strains for that specific season. It does not protect from other viruses that are also present in winter, such as rhinoviruses or RSV, and which also can lead to severe respiratory illnesses. And common side effects of the vaccine would be, again, the same symptoms that I mentioned: fever, muscle aches, nausea, headaches. It's almost having the flu again. And that's why it's very hard to I mean, decide if the vaccine is going to be okay or not. But this is something left to the decision of the patient. But we are just here to explain these specific pros and cons on where somebody should decide and put their finger on. The thing here is, for us clinicians, we doctors, we get trigger happy when we see infections, fevers, and flu. So, because oftentimes we give out antibiotics and we misuse them thinking that these are bacterial infections, leading to drug resistance and damaging of the gut microbiome or gut flora.
Hmm, interesting. So, you almost have, you're talking about a flu vaccine, I take it.
Mhm.
Yeah, so you have to decide, almost have to decide if I want to give myself the flu to prevent the flu.
Well, again, as with everything that I told you, sometimes though it's a very small amount that people have the reaction, but it's still out there that we have to explain to the patient if they do decide to go that route.
So how do they, you said each year the flu shot is designed for the specific flu for that year. How do they get it that fast?
Well, this is what we call the mutation, and they share what we call in microbiological terms, they kind of change presentation or receptors, and that's a thing. But the basic picture here is just they they just mutate. Maybe that's a better term for it, which we're hearing now with COVID-19, and viruses are notorious for that.
Okay, so on the flu, you said, how effective is a vaccine for the flu? Did you say how effective that was?
No, I didn't mention that for the reason that, again, with the effectivity, I don't have the exact numbers for that. But the basic premise that we tell our patients is it is not an assurance of a patient getting the vaccine being protected from the flu once it gets into their system, for the reason that it might be a different strain. Or if the
Gotcha,
patient
gotcha.
is immunocompromised, then you are really set up for disaster.
Okay, so your clinic is integrative. So what are some natural ways to fight the flu or maybe prevent the flu? What do you do? What's your first course of action?
So now we come into the discussion, Steve, of the natural flu fighters, as we call it. In general, and what I'm going to be mentioning are all according to medical studies, that One example, or the first one that I can mention to you, is the increased consumption of fruits and vegetables actually can minimize the complications of the flu, and it lowers the incidence of hospitalizations. And then also with another one is green tea, which can actually reduce the occurrence of the flu at least 3 times more than actually just drinking water. And these are studies that are done in healthcare workers. And again, another fact would be gargling green tea. It does look weird because you don't gargle green tea, you drink it. But the study had shown that gargling it lowers the incidence of the flu 7 to 8 times versus only gargling with water. And this was done in patients in nursing homes. And a head-to-head comparison with green tea and coffee, green tea 15 times, increasing the when you actually take at least 6 cups a day versus coffee, which has no effect at all. Another one would be kiwi. So this is the fruit. It's not the green, but it's the gold fruit, which lowers the severity and duration of congestion and sore throat down to 1 day for elderly people. And for preschoolers, the chance of getting the flu when they take gold kiwi is reduced by 50% and will improve symptoms if they already have it. Another one would be wakame seaweed, and this is found in seaweed salads. It boosts the antibody production for better virus protection, and it enhances the antibodies that you would promote and create after receiving the vaccine if taken 1 month after the vaccination. And another one would be baker's yeast. Baker's brewer's nutritional yeast, beta glucan, stimulates the immune system. Once ingested, it is recognized by the body as a foreign invader, and it revs up the immune system. It's like you're making it angry to kill incoming infections, such as the flu. And the chance of catching a cold when you take brewer's yeast is lowered by 25%. 1 teaspoon a day is all you need for this effect, and having anti-inflammatory properties is an extra bonus. But here in the clinic, our go-to would be, of course, supplementation, building that immune system through high doses of vitamin C, intravenous hydrogen peroxide, ozone therapies. These are oxidative therapies that are all focused in killing infections and boosting your own immune system.
Well, I know brewer's yeast is kind of yucky, even a teaspoon, but golden kiwi is delicious.
Right, right.
And if you gargle with green tea and you swallow a little bit, you're fine. Right?
Yeah, you definitely can.
All right, well, great information, Doctor. We thank you about telling us about the flu. Dr. Nario, Biointegrative Health Center in Reno. Thank you, Doctor.
Thanks, Steve.